Good afternoon, everyone. We'll begin in 60 seconds. Good afternoon, everyone. We'll begin in 60 seconds. We will begin in 60 seconds. Ladies and gentlemen, we'll begin in 30 seconds. For those joining us live, you may begin your countdown in 30 seconds. Good evening, everyone, and welcome to the Office of the Prime Minister here in Kingston, Jamaica. My name is Naomi Francis. Prime Minister, the Most Honourable Andrew Holness, will have a press briefing at this time. The Prime Minister is joined by the Honourable Dr. Horace Chang, the Deputy Prime Minister and Minister of National Security. Along with Dr. Chang and the Prime Minister, we have Dr. the Honourable Christopher Tufton, the Minister of Health and Wellness, the Honourable Robert Morgan, the Minister without portfolio in the Office of the Prime Minister with responsibility for information, Mr. Dunstan Bryan, the Permanent Secretary in the Ministry of Health and Wellness, and Dr. Jacqueline Besesa McKenzie, the country's Chief Medical Officer. The Prime Minister will give his briefing, and we expect just a few questions, and we should be complete within 45 minutes. Prime Minister.
Thank you, Naomi. I suspect we will be complete in 30 minutes or less. Good evening, everyone. The purpose of this very short press briefing is to announce, as required by the DRMA, changes to the measures that will go into effect as of this Friday, February 25, 2022, when the current measures expire. Based on the latest report from this morning, Jamaica recorded 36 new cases of COVID-19 yesterday, and our test positivity rate was 4.4%. Our daily case count has been decreasing steadily and is now back to the level we had in mid-December 2021, prior to the start of our fourth wave. Our average daily number of new hospital admissions has also been declining. Our COVID-related hospitalizations are now less than 50% of our COVID bed capacity. With all our indicators showing a rapid improvement since our peak in January 2022, the science and the data would clearly support a further widening of the guardrails to allow more economic and social activity. The Cabinet met yesterday and has decided to implement the following changes to the measures effective Friday, February 25, 2022, for a 3-week period to March 17, 2022. 1. The curfew hours will change from 11 p.m. nightly to midnight until 5 a.m. the following morning until 5 a.m. on March 18, 2022. 2. The current maximum of 20 persons allowed to physically attend funerals and burials will be increased to 100. This number includes mourners, clergy, and any other support personnel. As a reminder, burials are permitted only between 9 a.m. and 5 p.m. Mondays to Friday. 3. The maximum number of persons for events hosted by public sector entities will be increased from 50 to 100. As a reminder, a maximum of 100 persons may be physically present at weddings and annual general meetings of companies. 4. Effective Tuesday, March 1, 2022, the requirement to obtain a travel authorization through the JamCovid or Visit Jamaica platforms will be eliminated. However, we are at this time maintaining the existing pre-test requirement for a negative PCR or antigen test conducted within 3 days prior to travel. We are aware that obtaining pre-tests is becoming more difficult and expensive in some jurisdictions. We are therefore reviewing whether or not we should maintain this requirement or modify it. 5. Concurrent with the removal of the travel authorization, effective March 1st, 2022, we are eliminating travel-related quarantine requirements. I hasten to add that we are still strongly recommending and encouraging persons to limit their movements for at least 5 days after returning from travel. In particular, I urge persons who have traveled to distance themselves from those who are most at risk persons who are 60 years and over, persons with comorbidities. So when you have returned from your travel, please cautiously entertain your family members or visit your elderly parents. Bear in mind that they are still vulnerable. I also want to emphasize that isolation requirements remain in effect for persons who test positive for COVID-19. Persons who test positive must isolate themselves so as not to infect others. So these are the changes that we have made. We should bear in mind that the pandemic is not over. And though we acknowledge the high level of fatigue in the society, we have to gradually widen the guardrails. We have an objective which is of great importance, and that objective is to get our children back in school after the midterm holidays. All children will go back to school for face-to-face, and therefore we have to be very careful at this period of time not to open up too much and, God forbid, there is a resurgence. So we all have to still exercise caution and patience. We give the children the priority to get back into school. We have 3 weeks of these measures left, and then at the end of 3 weeks, it is quite likely that we will bring the measures to an end. So I ask for the patience of our Jamaican people, who I know, and despite their level of frustration, and indeed some are very angry, that they do understand the difficult position that Jamaica finds itself, particularly as we are only 20, we're just over 20, we're about 23% now fully vaccinated. These are the constraints that we face, and we ask for your understanding and indeed your faithful application of the measures that we have announced. Thank you. Minister Tufton is here if you want to say a few words, if you are so moved.
Thank you, Prime Minister. And of course, we, under the COVID protocols that we've outlined, we sanitize and allow Minister to speak. Minister.
Well, there's not much more to say. The Honourable Prime Minister, I think, has outlined the context and the changes, which are very clear. Just on behalf of the team at the Ministry of Health, the PSCMO, and the other critical practitioners in the field, to say, you know, we are very grateful to the Jamaican people who have supported these measures over time. We do recognize that 2 years is a long time to be restricted. We are assessing in public health some of the side effects of the restrictions, mental health side effects or children and the impact on them. And we have tried to provide the necessary guidance through offering clinical advice to support the measures that the Prime Minister has announced. As it relates to our children going back to school, this is very important. We've been working closely with the Ministry of Education, the Minister. We are making provisions through the protocols to ensure that while the social or physical distancing may be difficult, with nearly 600,000 students going back into the classroom, some of these classrooms are not large enough to facilitate the distancing that would normally be the case, that we compensate that with the sanitization, with the mask availability, with also testing. As you would have heard, we have announced the availability of tests in the wider society through home testing. Kits have been approved by our standard agency, and those kits are available. We have bought some through the public system, the National Health Fund. We're working with the Ministry of Education to offer those kits within the school system as part of the monitoring, and of course from their referencing to the health centers. And in addition to that, those kits are available in the private entities, pharmacies and so on. And we do encourage companies and individuals to utilize those kits that have been approved as part of the screening process. So we believe that we are seeing the tail end, certainly, of the fourth wave. Today represents the first time that we have seen positivity rate below 5%. 5% is the benchmark. Today we had 4.4%, which is very positive, and hospitalization less than 50%, 300 plus beds occupied of the 740 or so beds that are available for COVID. This augurs well, we believe, for the elimination of the restrictions around elective procedures. Some hospitals have already begun to deal with cases that had to be pushed back to give priority to COVID cases, and you will see more of that in the weeks to come. So we do feel hopeful, based on the advice of the clinicians, that we are seeing the better days and the worst days of COVID have passed. But as the Prime Minister said, we should not take it for granted. People are still dying, particularly the unvaccinated. And I close, Prime Minister, by saying, in the interest of vaccination, we do have 1.4 million doses of vaccines in stock, available across the country. Today we received, was it today or yesterday? Today we received 200,000 doses of AstraZeneca. We have J&J, we have Sinopharm, we have Johnson & Johnson. So Jamaicans have a choice, and they have the option, and we do encourage that because vaccinations still represent the best protection against this virus. We will continue to work with you, the public, and we crave your understanding and support as we work towards the closing end of the COVID threat that has confronted us for the past 2 years. Thank you.
Thank you so much, Minister. Thank you so much, Prime Minister. We'll take two questions as we move to wrap. Ahead of the start of the press conference, I did have a conversation with members of the media asking if they would be able to ask those questions very succinctly and quickly. And so let us then start with Ms. Janet Silvera of the Gleaner. Janet, good evening.
Good evening. Thank you very much. My questions are, what will happen to the unvaccinated persons who weren't able to attend an event like a Gibson Relay? Will we be seeing a change where that is concerned? One. Two, how are we going to be treating entertainment events?
Let's start with entertainment events. The Minister of Local Government, Minister Desmond McKenzie, will be coming shortly with a plan that is being contemplated right now as to how we will treat with entertainment events. Within the present protocols that exist and that has been announced, the attendance at large events which still pose a risk to public health in terms of spreading of the virus. The position based upon science and advice, public health science and advice, is that it is best to have only vaccinated persons gather en masse. For those of you who follow, for example, things like the Super Bowl and other large gatherings overseas, you would see that they do maintain some of these requirements. And it's not unusual. So I am sympathetic towards persons who are not vaccinated. In fact, you know, kids are going back to school who won't be vaccinated. But it's all about just trying to get the right balance as we carefully exit. All right, so, you know, I'm not of a mind or of a view that says that unvaccinated people should be discriminated against. But in the balance of trying to just make sure that we do not see a recurrence and a surge, there are just some things that we have to carefully do. And I think that if we all cooperate as a country and not try to divide and split hairs and you know, get tangled up in all kinds of I mean, my view is that a lot of it is quite unnecessary, because the truth is you have a government that is quite sensitive to the concerns of equity and equality and fairness. But we are also quite concerned and sensitive to ensure that our hospitals can stand up and treat people who need treatment. And lost in all of this are the hundreds of patients who have not been able to get their elective surgeries done because we have had to direct the resources to protect and make available to treat persons who become infected with the virus. So it's a grand balancing act that the government has to be doing. I can't say we have always gotten it to the satisfaction of everyone. But I think at the end of the day, when you look at our numbers, we have done well with the resources that we have. Thank you.
Yes. Our final question then comes from Mr. Arthur Hall. Arthur? Arthur?
Prime Minister, there are just two quick things. You have not spoken to the mass for children in school, particularly our young children, and small entertainment events such as round robins and street dances and parties. What's the government's position on both of those?
Well, as I've said, the Minister of Local Government is has developed. I mean, it's in the final stages, and it will come to Cabinet at our next Cabinet meeting on Monday. We will refine it, and then we will come to the public to explain exactly how the entertainment sector will be reopened. And I tell you, we're very concerned that the entertainment sector has been so badly hit, particularly the formal sector. And So it's not just about reopening, it's also about how we offer support to the industry to return and to return safely. So that is being considered. For children, the protocols apply to them equally. You know, we have said it over and over again. Wear your mask, sanitize, social distance. I would hope that by now, this would become public health second nature. This is how we're going to have to live with the pandemic. You're just going to have to internalize this kind of public behavior. And teachers will have to incorporate that into their teaching in the classrooms. So if I didn't say it here, forgive me. I'll say it just to be clear. The wearing of masks is still required under the protocols. And even when the Disaster Risk Management Act is removed, I am quite certain that it will remain a public health requirement until we are certain that we are out of the pandemic. Ladies and gentlemen, thank you so much.
Prime Minister, thank you so much. And that concludes our briefing for this evening. Again, the Prime Minister announcing changes to the COVID measures. Joined the Prime Minister this evening, the Honourable Dr. Horace Chang, the Honourable Christopher Tufton, the Honourable Robert Montague, Robert Morgan, Mr. Dunstan Bryan, the Permanent Secretary in the Ministry of Health and Wellness, and the country's Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie. Thank you so much for joining us, and we look forward to seeing you next time. Good evening.